You're listening to The Mountain Spirit, a podcast of Christian Appalachian Project, or CAP for short. This is a place where we get to share with you inspirational stories of faith, service, and compassion. I'm your host, Tina Bryson. I'm a firm believer that we're all connected by our shared humanity, and that finding that intersection sometimes just means having a conversation. Today we get to hear from Mike Halligan, CEO of God's Pantry Food Bank, which operates in 50 counties in central and eastern Kentucky. It represents one part of a nationwide system of organizations working to create a hunger-free America. I hope you enjoy the show. More than 44 million people in America face hunger, including 1 in 5 children. Millions of people don't have enough food to eat or don't have access to healthy food, according to the USDA's annual report. But Mike Halligan, through his work at God's Pantry Food Bank, knows we can be effective when it comes to reducing food insecurity for our most vulnerable populations. He leads this critical organization to help fight hunger among nearly 260,000 people in central and eastern Kentucky. Through policies and programs, we the people can turn this situation around, not just in Kentucky, but across the nation. In 2022 alone, 49 million people turned to food assistance for extra help. Food banks, food pantries, and community organizations rise to this challenge of helping children, their families, and seniors access affordable, nutritious food. People experience food insecurity in every community in America. However, people in rural areas and the South are often more likely to lack access to enough food, according to Feeding America. This is because of many factors like poverty, unemployment, and the cost of living. As CEO of God's Pantry Food Bank, Mike makes his case for why everyone should be concerned about food insecurity and join the effort to combat hunger. That might mean helping people understand a variety of challenges our children face with having enough nutritious food, or highlighting high food insecurity rates of seniors and older adults throughout Kentucky. He is a true believer that we have the power to change things. Listen to his story, and you might become a true believer too.
I was born in Muscatine County, Iowa. So one of the things that's really interesting is Iowa and Kentucky have some similarities. Now, Iowa doesn't have the beautiful Appalachian Mountains, but the influence of agriculture is actually fairly similar. And my whole family grew up farming, and my wife's family, she was born and raised on a farm. So the influence of agriculture and the work ethic that comes with an agricultural life is a big part of who I am. And it's helped me understand the importance of service before self and the importance of working hard to help people advance. And that's a big part of why I do what I do today at God's Pantry Food Bank. The definition of food insecurity is the inability to consistently put food on your table in order to thrive. Simply put, you're hungry, but not of your own doing. Circumstances that you might be living in that causes you to miss a meal. And it's often an economic situation where you have to make a difficult choice between medical expenses, or housing costs, or loss of a loved one, or loss of a job. And hunger is what happens to someone who is in one of those circumstances. Part of it is the cost of living and the economics and inflationary impacts and all of those kinds of things. So sometimes it's a low-paying job where you don't have enough funds, enough financial resources to make ends meet. Some of it is education. There are so many jobs in this country that require education, and if someone doesn't have that, they can very quickly fall behind. Sadly, some of it is the zip code that you live in or your ethnic background. There are all kinds of structural challenges and biases that lead to someone being thrust into hunger, food insecurity, through no fault of their own, but through the systems that exist that create disparity from one individual to the next. Hunger is what happens to someone who finds themselves in that circumstance. So what we try to do is meet people where they are. The way to think about our work is we are a resource provider of food and in some cases funding to food pantries and meal programs all across central and eastern Kentucky. There's more than 530 of them. So the way to kind of think about that is a food pantry is a grocery store for someone who doesn't have the funds to be able to go to a normal grocery store and shop. A meal program is a restaurant for someone who doesn't have funds. So think about it as a soup kitchen or a shelter where someone can get a prepared meal on site. Our job is to provide food resources to those organizations that are helping locally. You don't end hunger in a food bank. You end hunger out in the community working with local resources, because Magoffin County is different than Pike, and Pike is different than Owsley, and Owsley is different than Fayette. And so our role is to help provide resources, primarily food, some funding, so that all of those food pantries and meal programs can do the great work that they're doing in the county where they're at. So think about it as a consortium. Feeding America is a national hunger relief organization. There are some 200 food banks that are partners of Feeding America. We're all independent 501c3s. We share best practices with one another. We collaborate on advocacy. It's not a national organization with members. It's a consortium of independent 501c3s. Christian Appalachian Project is the same thing, an independent 501c3 that has localized services in several counties that you work in Appalachia. And so it's organizations that see the importance of getting a meal on someone's table and collaborating with one another to do that, and to find ways that we can complement one another's work for the betterment of those who are experiencing hunger. And it's about meeting those who are experiencing hunger where they are and providing the services that help someone get to that journey in life that they're looking for. So, it's sort of almost a tale of two stories. In the middle of the pandemic, we actually saw demand for emergency food assistance from the food bank go down. And the reason why we saw that is the SNAP benefit had a maximum allotment. So those that were eligible for SNAP were getting more financial resources. There was a child tax credit. There were stimulus checks. So there were all kinds of financial resources that were available from the federal government to those who were eligible, that provided financial support that allowed people to go to grocery stores to get food. Now that the pandemic is over, all of those benefits are gone. We're now seeing an increase in demand on food banks because the financial situation has now changed. There are some who lost jobs. Think about the hospitality industry and the restaurant industry. And I'll use a really simple example. I just got back from a couple of week trip. We were at 3 weddings, but in every single one of those hotels that we stayed in, there was a sticker on the door that said, if you want your room to be clean, call us. What it used to be that every day you would have someone come into your room and clean your room for you. Those are lost jobs, because that's not what the hospitality industry, that's not what hotels are doing today. So one of the outcomes of the pandemic is businesses who have changed their business models that ultimately affect entry-level jobs. People don't have that work. Now they're looking to a food bank, to a food pantry for support. Restaurant industry, same thing. There are less restaurants in business today than were in business before the pandemic. And many of them have not gotten back to a full week. They take Sunday, Monday, Tuesday off. They only are open Wednesday, Thursday, Friday, Saturday, or whatever their schedule. Those are lost jobs. That's a change in economic condition for someone who's experiencing food insecurity. It's causing them to be more hungry. So that's an outcome of the pandemic, and we're seeing the increase today because some of those benefits that existed during the pandemic aren't there now. So the way to kind of think about all of this is there are all kinds of resources available to individuals during certain circumstances, during certain times, and those resources can change. Someone can all of a sudden be thrust into food insecurity because circumstances around them have changed. So the way that we think about our work is meeting people where they are. And that's true for someone who's experiencing hunger. That's true for a food pantry or meal program that is trying to address the issue. When infrastructure is lower, We'll supplement that infrastructure, we'll complement that infrastructure with a mobile pantry or with a CSFP program. CSFP is Commodity Supplemental Food Program funded by the U.S. Department of Agriculture for seniors age 60 and above. So if the infrastructure in a county is less than what the county needs, part of our role is to complement, to supplement, not to replace, to complement or to supplement the infrastructure that is there to provide more access to food for those that are living in a particular county. That's one of the reasons why we're expanding some of the things that we're doing here in Fayette County as an example. We got a grant during the pandemic from HUD that was geared towards providing additional services when businesses were shut down. And we started to get a really clear picture of where people lived and where we had pantries. We have since added a pantry at the north side branch of the library. We're in the process of adding another pantry over on 817 Winchester Road. We do the same thing in many counties. When the infrastructure isn't there, how can we complement, how can we supplement to make sure that people have all of the access that they need in a way that's convenient for them so that they can get food so they can thrive.
Stay tuned. We'll be right back.
Does your construction business want to make a difference? The Lend a Leader initiative gives trained professionals the opportunity to serve our Eastern Kentucky neighbors who are living in substandard housing. Join our monthly mailing list to receive one-day opportunities for carpenters, electricians, plumbers, drywall installers, and painters. No commitment necessary. Email volunteer@chrisapp.org. That's volunteer@chrisapp.org to learn more.
The Supplemental Nutrition Assistance Program, or SNAP, helps low-income people buy food for healthy meals at participating stores. Kentucky SNAP benefits increase household food buying power when added to the household's income. But a household may have no more than $2,250 in cash and assets to be eligible. And if the household member is 60 or older, the household may have no more than $3,500 in cash and assets. And WIC is a supplemental food program that provides nutrition counseling, breastfeeding support, education, nutritious foods, and referrals to healthcare services. WIC improves the health of pregnant, breastfeeding, postpartum women, infants, and children up to age 5. Nonprofits and government programs work to help families secure nutritious, affordable food in an era when programs that help low-income or rural communities are portrayed as handouts. Listen to Mike talk about these issues in Kentucky.
So here's something that's really important. There are some who look at SNAP and call it welfare. It's not. It's a nutrition program. It is designed to be a bridge for someone who is in some unfortunate circumstance, not of their own doing, to be able to get good nutrition so they can get on the path to wherever they're trying to go. A business has an economic downturn. They choose to put people on layoff, right? Because they don't have the same level of business that they had before. It's not the fault of those who are laid off, but now all of a sudden they don't have the funds they need in order to be able to put food on the table. SNAP is designed to be able to be that bridge so that someone can have nutrition, so that they can go to an interview and concentrate on doing well in the interview versus having their stomach growling while they're trying to interview. So it's important to remember that SNAP is not welfare. It's $25 to $40 a month. It's intended to be a short-term bridge that provides nutrition. But when you're a senior on a fixed income with limited resources in an inflationary period and you get $25 to $30 or $40 a month, it doesn't take you very far. So now what are the other resources that might be available if you're in a difficult financial circumstance to be able to get nutrition so you can thrive? In Kentucky, aged 50 to 59, second worst in the nation for food insecurity. In Kentucky, age 60 and above, that number changes a little bit from year to year, but it's generally speaking around fourth worst in the nation. If you're 60 and above and your benefit is $25 to $40, you're going to make one trip to the grocery store in the month. What are you going to do the other 3 weeks of the month? And how are you going to make ends meet? So imagine if you're living in Lexington and you have to do a 2-hour bus ride in order to go get groceries. Then you have to schlep those groceries on the bus 2 hours back home. Doesn't work very well. So that's the whole thing about meeting people where they are. How can we have pantries that are closer to where people live so they can walk, or so they can, they can get there some way other than a bus and go and clear across town. Another great program that we're getting ready to kick off with the Lexington Fayette Urban County government is a mobile market. It's a grocery store on wheels. We're going to be providing the transportation. Kroger's actually going to stock the store. And the idea of that program is to go into food deserts so that someone can walk across the street or down the block and shop a one-aisle grocery store. So that's another great example of private-public partnership, thinking about solutions, getting outside of the box and asking, how can we help people? So it's very much data-driven, very much fact-based. So the way we kind of start was, what's the food insecurity rate in a given county? And there's an amazing amount of data that's available from the USDA, from Feeding America, from the Economic Research Services of the federal government at the state level, and you start to get a feel for which counties have higher insecurity rates, which counties have lower. So that's part of it. But there's also a piece of it about what's the infrastructure in a county, and that's the networking. That's the talking with folks in Magoffin County or in Wolfe County, or whichever county you want to use as the illustrative example, and learning what activities are going on in this county. One of the things that we do is we make a calculation called meals per person in need. So we look at the food insecurity data, and we look at the volume of food that is flowing into any one county, and we calculate a ratio of the number of meals that a person who is food insecure is likely getting. And there are some counties that are higher, and there are some counties that are lower. The ones that are lower is where we focus some of our energy on understanding how we can help. That's how the whole mobile pantry program started. That's why we've grown from 4 to 20, and we're close to being at 22. Our goal is to actually have a mobile pantry that is operating every day of the year in at least one county, and we're covering about 22 counties with that mobile pantry program. And again, that's to complement the food pantries and meal programs that are there to provide additional services. So that's kind of the food side. There's also a financial thing. About 2/3 of the agencies that we work with are faith-based, right? And they have little or no operating budget. One of the things that was very clear coming out of the pandemic is the volume of food was going down in terms of what was being donated and in terms of what was coming through the USDA and through the Kentucky Department of Ag relative to the amazing amount of food that was happening during the pandemic. But we knew the food needed to be higher. So what did we do? We pivoted to more purchased product. We went from purchasing $2 million of product a year to $6 in 2 years. And we were able to work with financial donors to be able to do pass-through grants to a lot of those faith-based organizations that didn't have the financial ability to purchase food, so that they then had a fund to purchase product. So it's food and it's funds, and it's being creative on how do you help those who need access to have the wherewithal to get the access. And now I'm talking about agencies. So one of the things I want to make really clear is someone who's hungry never pays for food. That food is available to them at no charge. But the economics of running the system impact all of the food pantries and meal programs, and we have to deal with inflation and all of those kinds of things. So that's a creative solution around how do we look at the economic side of it for managing a food pantry and to get sustainability there. And in a world where we've got to buy more, it's going to be more expensive to do our work. It ain't about me. And there are times when someone talks about the great work that God's Pantry Food Bank does. But at the end of the day, it's not about God's Pantry Food Bank. It's about 250,000 people in central and eastern Kentucky are hungry. And how do we work with partners and with community leaders and with people to make a difference. I once had somebody make a comment to me when I told them I was the CEO of God's Pantry Food Bank. That person said, "Oh, you're the one that owns all the food that the food bank distributes." And I'm like, no, it's 250,000 people across Kentucky that own that food. Our job is to facilitate getting it to them. When you think about childhood hunger, right, I think about backpack programs. I think about after-school feeding programs. I think about summer feeding programs. So here's an interesting tidbit of information. There are 2 times in the year where hunger escalates. One of them is during the holidays, right, when people are trying to do the right thing for family and loved ones and get gifts and share the blessing of the love around Christmas or whatever holiday your religion or your faith embraces. The other is when school lets out, because all of a sudden thousands of kids that are on the free and reduced price meal program don't have meals. So when I think about childhood hunger, I think about how do I get food to kids during the weekend? That's the backpack program as one approach. What about kids that both parents are working after school? How do you provide a late afternoon snack or an early meal before their parents get home? That's the after-school feeding program. In the summertime, how do you help families make ends meet when all of a sudden their food budget goes up? That's the summer feeding program. And 2 of those, the after-school and the summer feeding, have reimbursements available for service providers from the federal government through the Department of Ed in that case. The 3rd one, backpack program, is all privately funded. So how do you use those 3 programs in combination with SNAP and WIC and programs that are available for those that are eligible to make sure that you've got a fully rounded access to nutritious food? For seniors, there are a lot of seniors that are eligible for SNAP who actually don't use the program. So we've developed, and there are now several in the Commonwealth of Kentucky, God's Pantry Food Bank was the first. We developed a SNAP outreach program in partnership with the Cabinet for Health and Family Service to be able to do SNAP outreach to get more folks involved in SNAP where they were eligible. And we focused on seniors. So how do we help seniors, apply for and get a benefit on SNAP and reduce the red tape? That's another illustrative example of the kinds of things that we do. CSFP program, it's another one for seniors age 60 and above. Our caseload in central and eastern Kentucky is 15,375 seniors. It's, for one sponsored by a food bank, it's the 2nd largest in the nation. The only one that's larger is the Los Angeles Regional Food Bank in downtown LA. And we've got available caseload for seniors. So if anybody's listening to this podcast and they need more access to food and they're age 60 or above, that's an opportunity to explore. And that's food that is delivered to a centralized location. We actually have 103 sites in the 50 counties that we serve. So that's another example of thinking about a program and how do you apply a program where somebody's at to help them get the nutrition that they need.
Stay tuned. We'll be right back.
Did you know that November 28th is Giving Tuesday? On this global day of giving, families in need in Appalachia are counting on you. Thanks to a generous group of CAP friends, your gift gets matched up to $75,000. Don't miss this opportunity to provide nutritious food, warm clothing, critical home repairs, and Christ's love to twice as many people living in unimaginable poverty. Visit christianapp.org to give today and have your gift doubled to help children, families, and seniors in need.
I love Mike's passion for his work. He spent decades working in agribusiness and food manufacturing with a commitment to relieving hunger. And through the God Pantry Food Bank's partnerships with 400 community-based programs in over 50 counties, its donors and volunteers, he is making a difference. America is the richest country, and yet we have veterans, children, and vulnerable seniors who go hungry. We can change that story. Mike is on the front lines to help make that happen.
I'm a food industry guy. I've got 20 years with Quaker Oats and PepsiCo. I've got almost 10 years with ConAgra Foods. And honestly, part of what I see is the marketing that has occurred over the years has been about supersizing and adding to the plate. And the hard thing is that You can't recover food that's wasted once it hits somebody's plate. So honestly, some of that is our society, thinking about where we are nutritionally today. When we think about the incidence of obesity, and we think about the incidence of hypertension, and we think about the incidence of onset diabetes and type 2 diabetes, some of that is diet. And that translates into a higher amount of food waste because it's food that you put on your table, and then you don't consume it and you have to throw it away. So I think there's a huge part that is around dietary education on how we as consumers think a little bit differently about how we shop and how we eat and what we buy. So I think part of this is industry looking at ways that we market product today and how do we change society. That's not something that happens overnight. That's a long haul. I'll give you an illustrative example. Best of use by dates. There is a perception that when you see the date on a package, if you don't eat that product before that date, it's not safe, it's unhealthy. That's actually not true for the vast majority of food. That is optimal quality based on what a manufacturer evaluates for the quality of their food. I worked in the canning industry for many years. A lot of best if use by dates on a can of food is 2 years from date of manufacture. But a lot of that product, it can last 5 years, 10 years if that can is intact. Now, let me go to that point from an individual. So if you open your pantry once a month and you look at food that's getting close to food date, don't throw it away. Donate it to a food pantry. Donate it to a meal program. Donate it to a food bank because we can put it to good use. We actually have authorization from almost every manufacturer in the country to use extended code by dates. So if you see something in your pantry, don't throw it away. Donate it. We just reduced food waste by doing that. So I think a lot of it is about respect. Understanding hunger as a health issue and not as poverty is an important place to get people thinking about. A really good friend of mine and a peer out in Seattle, one of the things that she talks about is when you have unexpected medical expenses, hunger is what happens to you. That changes the conversation around it not being generational poverty, around it not being welfare. It's a circumstance. It's a circumstance that's solvable. How do we find a way of educating one another on what hunger is and what it's not? For lack of a better way to explain it, I'll bring up one that causes me to pause all the time. I hear somebody say, just pull up your bootstraps. And I'm like, I think their bootstraps are already pulled up. I would say, let's get some folks some nutrition so they can take those bootstraps that are already pulled up and walk down the road to do the next thing. It's changing the conversation to be one of the systemic biases and all of the other things that create circumstances for individuals, finding themselves being hungry, as opposed to just immediately assuming that someone's not working their backside off to try and improve. I haven't met anybody anywhere that isn't trying really hard to find themselves in a better place. And I'm going to share a story. And I apologize if I tear up on this one. I met a gentleman a few months ago at one of the pantries. He had on a baseball cap with a military insignia, had a jacket on with a different military insignia. And I asked him if he was a veteran. And his answer was yes. And I thanked him for his service. He then thanked me for hours. And so I probed a little bit. And what I found is that he had lost his spouse. I assume his spouse passed away. He did not say. He had lost his job. He had lost his home. And he was in a rough spot. And fortunately, there were people who had the grace and the dignity to help him access food. And he said, I'm in a better place today. Had it not been for the services that I got, I probably would have been dead by now. This is a veteran. This is someone who, through their service to our country, allows us to have the beautiful life that we have and the freedoms that we have. And through no fault of his own, he had a series of circumstances that thrust him into being unhomed, not homeless, unhomed, right? And not having food. Well, that's not his fault. He still had his boots on. He just needed a little help with navigating through a difficult time. And fortunately, he got it. And fortunately, he's still with us. That's the perspective that people need to have. That's what people need to recognize. And I think the more we talk about it and the more we engage with one another in conversations and learn, it starts by being willing to hear. And so having the grace of meeting people where they are and engaging in a conversation to learn versus making assumptions, it changes the narrative. And I am hopeful that we find a way to get there. Because there's amazing things that just about anybody that I've met has to say and amazing things that I have to learn. So I'll tell you another story. So a youngster, probably 4 years old, definitely wasn't in school yet. He was shopping at a Pantry with his mother. And they went around the corner, and back in the corner of the pantry was a bin full of bags of oranges. English was not his first language. Mamma mia, and then whatever oranges is in Spanish, I don't recall. He goes over and he grabs this bag of oranges, and the bag of oranges was about half of his size, and he drops them down into the buggy. And so I asked Mom, at least I assume it was Mom, it may have been a character, who knows. English was also not her first language. And she was crying. And I'm like, tell me, what's the matter? And she goes, there were tears of joy. He loves oranges. He hasn't had oranges for almost a year. And she was so happy. Now, I was happy that we were able to provide the oranges, but I was devastated that a 4-year-old couldn't have oranges for a year because they couldn't afford them. That's just plain wrong. What's the food justice? And how do we think about what we do to help a 4-year-old who needs that nutrition to be able to thrive in school? When I'm having a bad day at the office, I go volunteer at a pantry. Because that's why we do the work. We can look at budgets all day long, and we can talk about volume and how much food is coming from the USDA, and what kinds of partnerships do we have with the Kentucky Department of Ag, and how do we navigate financial support from donors to be able to add programs or to have more infrastructure. But at the end of the day, all of that is a resource to get to what really matters, and that's to be able to sit in a room, share conversation over food. That's how I get my energy. And I would tell you that our worst days, and we're like any other business, right? We have good days and we have bad days. Our worst days are better than some of the best days that I experienced in other jobs in the for-profit world in the past. And it's because of the mission, and it's because of the orientation towards service. Man, when I need to charge my batteries, I go to the Northside branch of the library, or I go to Central Christian, or I get on the road and head down to a Christian Appalachian hunger walk. And I can go on and on and on about all of the phenomenal partner agencies that we work with, because that's the real world. What I see across Kentucky, what I see in Appalachia in particular, right, is the hope and the pride that people have in their hometown, and that they're going to be in a better place, and the service that they choose to provide to ensure that that hope becomes a reality.
Our guest today has been Mike Halligan, CEO of God's Pantry Food Bank. We hope you've enjoyed the show and will check out next week's bonus episode. Tell your friends to check us out too. You can follow the work of Christian Appalachian Project on all social media channels, and find the show online at christianapp.org/podcast, or wherever you get your favorite podcast. Be sure to subscribe so that you never miss an episode. We'll see you next week.